Hi, Dr. David Whiteman, Southern Plastic Surgery in Atlanta. I've been in practice 30 years. I'm going to teach you something it took me about 30 years to learn. When we focus on a face and look at faces that are harmonious, I realize that what we're really looking at is this center area, eyes and central facial appearance. So, I'm not the only one that knows that. In fact, we know that facial recognition software and computer data, consumer data, knows where we look. Our brain looks at eyes and central face. That's how we do facial recognition software. The beauty industry knows that as well. You may recognize this as the inverted triangle of beauty. They're trying to sell eyeshadow, eyeliner, facial volumizers, lipstick. In my world, I look at this as somebody who's going through what I would call a menopause makeover. And in that situation, I look at somebody who would benefit from correction of excess skin on the upper eyelids, or blepharoplasty, volume loss in the midface, which is a very common sign of aging, corrected by fat grafting, long lips, and avoiding this overfilled, over-volumized lip by doing a lip lift, not filling you up with filler in the menopausal age group. And lastly, my favorite procedure, the croton oil peel, to overall improve the quality of your skin. And this is an example. This is a patient who I've corrected through upper lid blepharoplasty, removing the excess skin, no skin removal on the lower lids. All this tightening and all this improved skin quality is from a croton oil. I've also added fat. You can see the excess depression here, and now the correction with fat, and the shortened and more youthful appearance of the lip by doing a lip lift procedure with a scar you can't see. So in my world, I've taken kind of what I've learned and realized that we can translate this, because when her friends look at her, they're looking at her eyes, her nose, and that inverted triangle. And although we've done a neck lift, it's really not the emphasis that I'm looking for. I want to create a more youthful, central face and handle the neck when appropriate.